Okay, hi, welcome to my service learning presentation. So I'm going to be talking about improving COVID-19 education in majority Hispanic slash Latinx schools in Northern Georgia in the US. So first, I'll start with the context. Why is this an issue in this population and specifically in this region? So as you can imagine, accessibility to healthcare is one of the biggest issues. Poor transportation, systemic wealth gaps, these are things that contribute to poor accessibility, whether that be literal accessibility or financial accessibility. Housing situations are often more crowded and a higher density in lower income populations. And all of these contribute to higher rates of infection and poor outcomes in minorities. And in this specific case, we are talking about the Hispanic population. So, as you can see, in 42 US states, there's the issue of Hispanics and Latinos making up a greater share of confirmed cases than their share of the population. This is just showing that it's hitting this community very hard and that it's really also more of an issue in Georgia because it's the number 6 US state with the fastest growing non-metro Hispanic community. And there's an emphasis on non-metro because there's a whole set of issues that come with being in the rural part of the state. Changes your political climate and the accessibility we were talking about before. So let's take a look at the problem landscape a little bit deeper. So many Georgia public schools have reopened, and this is under advice from the state government. Despite the health risks, these schools have still chose to open for this semester, and there's many factors that lead to disparity in these schools. So many of these students, including the population I'm studying, they're less likely to be able to afford options that would allow them to not go to school if they felt safe. So by these schools opening, they're basically giving these kids no option but to attend it, whether this be because they don't have the proper technology for the remote schools for economic reasons, or maybe something like childcare, and so they can't be homeschooled because they're too young to be home alone. So then we see on the right that just a statistic about how many people in Georgia actually are struggling to even choose between bare necessities, food and medical care being the ones in question here. Just shedding light on how pressing this issue is for people in this population. So next we'll move to the solutions landscape. So the CDC has proposed that more testing centers in minority communities would benefit this issue and resolving this issue for obvious reasons. If more people are aware that they are positive, they will be more likely to stay at home and not spread it throughout their community. But this would also involve a lot of bias training in medical facilities because often people, specifically in this case, we're talking about Hispanics and Latinos again, face discrimination in healthcare facilities for systemic reasons, but also one-on-one contact in these facilities. That's why they need bias training. And then just break down the systemic racism in the medical system here to prevent this in future pandemics or other health crises. But the one that I'm going to be focusing on is the accessibility to information. I think that this is one of the things we can do in the short term to really reduce the spread throughout these communities, because as much as the other ones, they are super important and very relevant. The accessibility to information is something that is hard in the rural population and specifically in Hispanic and Latino populations. And I will talk about that next in the gaps and levers of change. So one of these issues may be the language barrier. So there's a lack of public health education in Spanish, especially in rural areas. So a lever of change for that would be easily accessible educational information in the native language of Spanish. So next would be just the disadvantage for Hispanic and or immigrant public school students. So urging schools to provide the safest school experience for students without the privilege to stay home or attend school online would be the lever of change for that issue. So next, after you've seen this kind of explanation of what's going on at the deeper level in this issue, I'll now talk you through what I'm actually planning to do for the project and how I'm going to address these issues and implement some of these levers of change. So first is my rubric. I've chosen 5 learning targets. As you can see, some of them are more personal growth around the techniques involved in service learning projects, as well as some of the concepts and how to develop a strong project. But then there's more about the content, such as 7C5, kind of understanding how politics have influenced this issue and how the issue fits into politics. Next would be the SDG goal that I chose. So that would be number 3, which is good health and well-being. I chose this because the ultimate goal of the project is to reduce the spread of COVID-19 in an already vulnerable population. So that's, the SDG. So next I'll talk about my apprenticing the problem. So I completed this over the last break in May through August of 2020, working with the Trinity Community Ministries, which is a homeless shelter in downtown Atlanta. So my community expert was Felicia Jones. She helped facilitate me teaching proper mask wearing etiquette, sourcing masks, sourcing safe food and meals for the men staying at the shelter. There I learned a lot about why certain populations are so vulnerable right now and kind of the state of their knowledge about COVID-19 and safety precautions that they should be taking to stay safe. So I kind of got a good understanding or better understanding of why and how specific people are struggling right now. And even though this was in the urban setting, I do think it can be applied in a rural setting, or that the comparison will be interesting and helpful. Next would be the timeline. So for the rest of the term, I'm hoping to continue working on identifying the schools with the need for this project. So that would be certain schools with a high density of the population I'm trying to target. There's certain counties that I'm already aware of where it will be the right population. Then just continue to communicate with these schools and draft infographics with Christine, who will be helping with the Spanish part. And I'll be taking a Spanish course on medical Spanish so that the content will be accurate. Then I'll finish that content, and moving into term 2, presenting, following up on the effectiveness, and reflecting and refining. And then moving into the break, refine it, present again, and finalize the project by term 3. For the action activities, so what I'll actually be doing and producing would be 4 unique infographic posters on COVID-19 safety measures. So I'll be using the platform Canva. The goals, as you can see there, as I said, reduce transmission and hopefully educate the greater community, using kind of the kids as a vessel to teach the rest of their family, and hopefully it'll have a an impact on the larger community, not just the kids attending school. So in my risk assessment document that's linked here, I really just outline risk related to auto accidents because all the communication will be done online. The only thing I may do is drive through these communities just to have a better idea of what already exists in terms of COVID-19 education, but I don't plan on leaving the car or really entering a high density area of infected people. Okay, and last would just be the bibliography to show you all the helpful places I got this information from. So that's all. Thank you so much.